Namaste and good afternoon. On behalf of Apollo Hospitals, I'm delighted to welcome you to yet another session of our Corporate Health series. This is Dr. Srinidhi Chidambaram here. This series aims to bring focus on health issues that you, as part of the corporate world, are at particular risk for, as well as health issues that are prevalent in the population. We hope this series helps you to function at the peak of your productivity with minimum stress and maximum well-being. I'm delighted to welcome you today to a session which is all about managing a very, very common health condition in the workplace, diabetes. The International Diabetes Federation has recently mentioned that there are over 537 million adults who are now living with diabetes worldwide. It is a fast rising problem, and it is definitely one of the fastest growing global health emergencies of the 21st century. India too is home to a large number of people with diabetes, and it is often said that it is well on its way to becoming the diabetic capital of the world. Of course, we know that it is unusual that diabetes would actually restrict your occupation or job choices. But the major challenges experienced by people working with diabetes may be around their diet, their exercise, their lifestyle, their blood sugars, and of course, a few emergencies too. And they might also be experiencing some tiredness, fatigue, or vision issues. So it is important to understand how we can manage diabetes at work so that you don't let the diabetes get worse, nor do you let the diabetes complicate your progress and success at work. So to enlighten us on this important topic, I welcome Dr. Mahesh Chavan, who is a senior and highly renowned and qualified endocrinologist with over 12 years of experience, currently practicing at Apollo Hospitals in Navi Mumbai. He is a dedicated physician with a focus on both adult and pediatric endocrinology, specializing particularly in conditions like thyroid disease, growth failure, delayed puberty, diabetes, and pediatric endocrinology. Dr. Chaban's impressive background includes MBBS, MD in medicine, DNP in endocrinology, along with a fellowship in endocrinology from the PD Hinduja Hospital in Mumbai. His dedication to the field is further evidenced by his membership in the prestigious Endocrine Society of the US and his status as a life member of the Indian Society of Bone and Mineral Research. Dr. Chavan, welcome to our Corporate Health series.
Namaskar.
Thank you so much for joining us. Namaste. So we will begin with the basics. So let me first ask you, what is diabetes? Could you explain that to our audience in simple terms?
So diabetes, even though we all use the word diabetes so commonly, but it's actually a disease. Even though we think it's a disease of sugars, but it is a disease, protein, carbohydrate, and fat. So it's a disease of metabolism of all three fuels. But to the common public, I would like to say, even though we use sugars as the basically diagnostic part of for diagnosis of diabetes, there is fasting sugar more than 126 and PP sugar more than 200. And two occasions or HbA1c more than 6.5%. So either of these three can be positive and called as diabetes.
So what are the common risk factors for developing diabetes? We know that it is fairly common today. So what makes people, and also why do you think it has become more prevalent today?
So being born in India, I always tell my patient, being born in India is becoming the major risk factor for developing diabetes because of the genetic makeup. Like thousands and thousands of years of lack of food has made our genes thrifty, and that's why they will convert everything what we eat and store it in the form of fat, and that's why obesity is on the rise. Along with that, stress, stress of living in a metropolitan city, and workplace stress is to contribute to, and of course, with stress, the high level of cortisol, and this cortisol again causes binge eating, and people tend to eat whatever comes in front of them, and that also contributes to obesity.
There is also this view that, when people have to start taking insulin, and I'm talking about people who need to take it even at the workplace, does that mean that, there's often this theory that, people think it's very severe if you have to take insulin. It is not a problem if you just are on oral medication. These are some of the common misconceptions. So what are the kinds of treatments, and what is the general way in which diabetes is now treated?
So, well, if you look at the pathophysiology of diabetes, so diabetes, there are beta cells which are present in the pancreas, and everyone gets a numbered amount of beta cells. Right? And these beta cells, at diagnosis of diabetes, almost 50% of these beta cells, which are responsible for production of insulin, are lost. And every year, around 5 to 10% are lost. So when we use medicines in diabetes, we are primarily asking these medicines to produce insulin and to go and attack the beta cell and produce insulin. So after a few years of diabetes, these beta cells which are on decline continue to decline and may stop producing insulin totally. And that's when we have to use the hormone which is deficient, that is the insulin. So many times, if we use it timely, the insulin, then along with oral tablets, and we can stop it after the emergency is over. Like any person who is admitted for surgery, the stress of surgery, we give insulin, and after a few days, we can stop it and shift over to oral tablet. So like that, we need to be prudent in deciding what needs to be done. Most of the time, in olden times, we were using insulin only at the last when nothing else is to work. But now, with the newer insurance, we are using insulin more proactively so that to preserve the beta cells and the people can live longer with this preserved beta cells. So, because of this, many times this question of that my diabetes has got worse and I have to live on insulin, this question always comes in people's mind, and we'll try to dispel this myth that it's not. We need to act on as the situation rather than we need to just get afraid of the insulin injection. As it is humanity, everyone wants to go away from pain, so they are afraid of the pain of insulin injections, and that's why there is fear of insulin. But with the newer devices, newer pen and pen insulins which are there, which have almost painless injections. And that's why there is more acceptance in the common public for insulin nowadays. But we need to educate people that giving insulin is not, we are not trying to punish them for bad behavior. It is to help them prevent complications. If we control the sugars well, then their complications will be delayed and they will be able to have a good quality of life. But just to avoid insulin injection pains, the pain caused by insulin injection, many people try to keep changing doctors and ultimately land up with severe complication of kidney failure, heart attack, brain stroke, or blindness. So we need to be very, very careful when we. So as a doctor, I always tell people to utter words carefully rather than use words in a threatening way. If you don't control your sugar, next time we'll give insulin. I would say we need to look at insulin as an option of treatment rather than keep increasing the dose of oral medicines and have more side effects.
You were talking about the pain of injections, another thing which diabetics often have to do, particularly in the context of the workplace. Also, they might need to measure their blood sugars regularly. Is it necessary for people, because now we have such advanced devices, so we have those patches, we have many things which track the sugars. Do people really have to walk around with all that, or in the corporate environment, just the usual annual, I mean, not annual, but then the visits to the doctor and the checking of the blood sugar? How often should they keep monitoring it?
So if a person is on oral tablets, they should measure it weekly. If a person is taking insulin, then they should measure it daily. Those people who are on single dose of insulin can just get away by once or twice checking. But there are many people who with a long-standing diabetes, more than 20 years, who are on 3 to 4 injections. These people need to check it frequently, 3 to 4 times just before taking insulin. But now these newer devices which are come, which help in measuring or knowing the trend of the sugars. So these patches which are there, which are will tell us up to 14 days. There are few with 3 to 4 days patch, and there are few which tell as long as 14 days. So the older parameter of our targets like time in range, time above range, and time below range, which is the information which you get with these newer patches, is more important nowadays to tell whether, because no one can check the sugar every 5 minutes or 10 minutes. These patches check it continuously and give us an exact way the sugars are behaving in the body, whether their insulin needs to be increased or decreased, or the OHs need to decrease, and how the food is affecting their sugars. So all this education is available when you use newer technology controlling that.
So, moving on to the workplace context again, I just wanted to ask you, how does that contribute to, there is everything that you spoke about. There is stress, there may be irregular working hours, there might be a lot of desk jobs, sitting and working. So, in this environment, how does it actually make your diabetes worse?
So workplace stress always contributes, and many times, like uh, in the workplace, because of there is excess tea drinking, people just don't want their colleagues to know about their illness, so they keep on adding sugar, and that is again adding more calories to what you are already having. And many times people skip the insulin just that other people will not know about their illness. And of course, the stress of completing the deadlines, reaching there on time for meeting, sometimes skipping meals because of the meeting, skipping the doses, skipping altogether, fasting whole day for just to complete the meeting. All these things happen. The one and only one thing I always tell about diabetes, the D stands for discipline. If you are disciplined enough, then you eat on time, you take your medicine on time, and then your diabetes also behaves in a disciplined manner.
So, what advice would you give apart from the discipline on the specifics of what people must plan for their diet? And we know that exercise also plays a big role in this. So, how do you advise people to plan these things?
So, many times people, when I always tell that if you're in Bombay, at least in Mumbai, where people need to travel for long periods of time. So, and in offices also, sitting is like new smoking. Like if you sit long enough, more than 1 hour, then it is again like smoking a cigarette. So you keep moving yourself. The unintended movements which our body does also helps in causing weight loss. Along with that, keep moving, Don't keep yourself stationary, and always try to reach to the place of the workplace or the meeting place on time, before time, so that we don't need to stress out, and that stress leads to um, uh, cause multiple um, errors in our judgment. So what we may need stack more, we may skip our doses, the oral tablets are skipped, the insulin may be skipped. Many times at workplace, people don't have fridge to keep the insulin, so the insulin may not be stored in the proper cold degree or the door of the refrigerator, and that do the insulin effectiveness goes down. And so, how to counter this is, again, if you plan the day ahead, you can always have your meal before your meeting, have your drugs before the meeting, because you don't know how long the meeting is. Many times, if you're employee, you don't know how long the meeting is going to continue. And many times I've seen executives skipping the insulin because they can't take it in front of their employees, skipping the insulin totally, which they have to take along with the meal. And then that causes a spike. So once the spike occurs, the blood flow starts getting sluggish. People have uh, increased sleepiness, increased uh, post-meal somnolence, what we call. And so all these things happen because of fluctuation in sugars. And this further leads to, again, they may snack more, they may have a juice or a tea, coffee, which was not required for them. And they may eat in a hurry, they may not. So multiple things happen. If you plan your day ahead, you can store your insurance, store your drugs. Always keep a bag of medicines at the workplace, so that if you forget from packing it from home, I always tell people to keep a strip at office, one in your car and one at home. And of course, most important we need to watch out is hypoglycemia. People, when they are diabetic, they take medicines, stronger medicines are there. If you don't eat on time, then their chances of causing hypoglycemia are much, much higher. And that further leads to complication even, and because our brain gets just 10 to 15 minutes to adjust. And if you don't eat on time, so the most best way to treat that is have a glucon-D powder immediately below your tongue, 2 to 3 teaspoons, and that gives that 15 gram of glucose, which helps your brain to recover and combat with the hypoglycemia. If that's not possible, take a juice, 15 ounces of juice, or again, eat a meal. But all these things take time to digest, and that's why the hypoglycemia worsen. And that's why we prefer to give glucose rather than anything else. So first of all diabetic patients must get prepared for hypoglycemia first. Hyperglycemia, you can visit at leisure to your doctor. If your sugars are 300, it is not going to immediately threaten your life. But if your sugars are less than 70, it is going to threaten your life. You just got 15 minutes to half an hour to correct your behavior.
So I think the key message there is to just be prepared and plan ahead. I think that would be the key message there. How can they introduce more physical activity in the day?
So I usually tell people patients to walk after a meal. So most of the time, if you get an hour for your lunch, then of course we don't eat for an hour. We eat for 20 minutes or so. You can have a walk 10 to 15 minutes immediately after that. Even after breakfast, it can be added, and after dinner also. So these are additional 45 minutes you get. And then, of course, you yourself can have a walk for 45 minutes. But again, that should be a brisk walk, so that you weekly dose of 150 minutes of brisk walking should always be there in the calendar, so that that gives our body to use the excessive glucose in the muscle, in the fat, in the body, which our body uses up. Walking is like taking insulin. That's what I would say, that your body utilizes more of glucose.
What tips would you give people who are constantly traveling? So they're not in a desk job, but they're in different cities at different days of the week. We have seen many people like that. So they have no way of really preparing their home food, or maybe not even exercising if they're constantly traveling or taking flights. So what can they do? I mean, this is not completely avoidable, isn't it? I mean, like at the peak of their career, they do need to do that.
So I always tell people who are always on the move that they should first pack their walking shoes, and then rest of the packing should be done. So man has been walking for thousands of years. So you can walk in any city, any part of the world where you can walk. And uh, walking for half an hour in a day, many times, just have a wake up early, start your day early, walk for half an hour, 45 minutes, and that makes your day. So when you add this, that additional movement of your hands and legs gives happy hormones to your brain. And these happy hormones make your day better, and your tone for the day sets. And then you will definitely you'll feel better about yourself, that you are exercised, and you look after your diet, so that whole day the tone sets in. Otherwise, it takes lot of willpower to wake yourself up after a long flight and go for a walk. But if you make it a habit, you start loving it.
Finally, I just wanted to ask you now on the other side, on the side of the management. So these days, I think there are many managements and leadership who are very sensitive about these things, but there is no uniform policy in most places about how the company or the organization can also support people who are diagnosed with diabetes. And I'm sure in all large organizations, there must be a huge population of people who are diabetics. But then, as you said, they may not be disclosing, or they may be just trying to manage, because it is often seen that when you're not well, you may not perform well, you may not be considered for higher responsibilities. So what would your practical advice be to managers and leaders on how they should make it easier for diabetics to work and also contribute well to their organization?
So I would say, well, the management should be more empathetic towards people who are diabetic, because uh, having diabetes is not their fault. It's the fault of the hormones and our genes and the inheritance which we have. Many times, if you look at a patient with diabetes and a patient with cancer, as soon as you hear the word cancer, everybody is very empathetic about that patient. Oh, he's got cancer. But for a diabetic patient, we always feel most of the people in and around them, even their family members, are not as empathetic as we want them to be. And they always feel that they are overweight or their sugars are uncontrolled because they are not taking good care of their diet and exercise regimen. But the most of our patients whom I see, they are very careful about what they put in their mouth, and they actually are taking good care. But in spite of that, the progression of the disease is such that these patients require help of the dietitian, the counselor, doctor, and occupational therapist for help in their exercise. So as it is, these people are already doing so much. So the management should be empathetic. I think if possible, the management should have an exercise room or something like that so that also helps building relationship in between the employees, and those who are diabetic can go. Say in Bombay, you start at 5, you reach by 8, 9 o'clock at home. That 1 hour, if they wait there, do their exercise, and then they come back and a little later, They may reach early because that 1 hour they spent in the office exercising. So there are multiple ways where management can help, and these they should encourage them for regular checkup. What we find most of the time is people just treat diabetes like other illnesses like blood pressure or thyroid, where the same dose of medicine keeps on continuing, whereas diabetes is what you put in a mouth. A diet has a role of 80%. So now mango season is going on every day. We are seeing patients with 500 and 600 sugars because uh, nobody wants to leave mango, and even taking a slice or more can increase your sugars. And then that's why they should follow up regularly. That should be made mandatory, that you keep your HbA1c within range and follow up regularly so that your patient, your employee, takes good care of his health. And as he remains healthy, he can protect the complications of diabetes, which are very common if you just lose focus. And I've seen people who took one painkiller just to avoid visiting a doctor, and the creatinine rising and landing of renal failure. So all this, the work-related stress are going to remain, and these people are better known to cope with it, but they need some empathy around.
As all of us do, I think. So thank you, Doctor, for this wonderful session. Viewers, please be aware that diabetes is a common condition. Working at an office will cause you stress because you have a lot to manage in terms of your health, well-being, and your job. But it doesn't have to be so. If you follow the tips that the doctor discussed, you can manage very well. Learning how to balance your food and exercise, your blood sugar, how to build movement into your day, how to manage your work and your life are all things that can be learned, and effective planning can take care of most of these issues. And the more you practice them, the more they will become second nature to you. So live your best life, even with diabetes, and be a star at work. Do contact us for assistance at any point of time. We're on there to help you at any time. And do contact our corporate healthline for any support or medical assistance that you may need. See you soon, and thank you. Namaste.